happy and thank you Help Library and everybody of you to call me back again in this session of my pain series lectures. And today's topic is hip and pelvis pain. Uh, we all know this region. This is the pelvis and the back part is known as hip. Now we see many conditions in our day-to-day lives, and in my own clinical practice I see many conditions. Though most of the conditions in this topic is mainly related to sports activities and sports people, because they are really overusing their hip and pelvis in so many different kinds of sports. But it's not that these conditions only pertain to them. We also see this in common people like you and me, from young people to elderly people. And as you will see in the topic that though most of us know fractures, and especially fracture neck femur, which I am sure that everybody must have seen at least one case in their families and known that how the person walks and what kind of surgeries they have had. But apart from fracture, there are so many interesting things which happens in the hip and pelvis, and this is really a masterpiece of God's creation, that this hip and pelvis, the way it has been framed in human beings, is with a very special view, that we have been given two legs to stand and to walk and to run, unlike animals in whom there are all four-legged creatures. So all the weight of the body comes on this pelvis. You can see this pelvis over here, and from there it is transmitted to these thigh bones, that is the femur, and then down the legs and the foot. So it is a masterpiece because these bones are really very strong, and the ligaments which holds these bones together are really very strong ligaments. And this pelvis, as you can see, is made up of these bones. One is this is the hip bone. It is made up of again three segments. This is the iliac bone, as we all know. It is over here. This is the pubis. This is the pubic bone, and this is the ischial bone. So all these three bones, they join together over here and form a cavity known as the acetabulum. And in this cavity or the socket, the ball of this thigh bone or femur is fixed. So this ball and socket arrangement gives it a very wide range of movement. We know this, that when we see Bruce Lee's films or other games and sports, that they can kick and they can do whatever with the legs as well as the hand. And on these bones, these projectiles, this is the greater trochanter, this is the lesser trochanter, has been given, so that most muscles which comes from the back, they all come and attach over here, which gives it a very strong structure, and it gives it also the stability that it requires for movement as well as weight bearing. And then the thigh bone goes down and ends up in the knees. So we start with few conditions first. Again, continuing with the anatomy, these are the ligaments, which you can see there are three ligaments over here, which joins the hip bone to the thigh bone, the ischiopubic, the iliopubic, and the sacropubic ligaments. And you can see this is the set of nerves which comes from the spine, and it goes down in the leg. This is what gives the leg muscles its movements, and it also causes many diseases when these nerves get strapped. The commonest of all that you all know is sciatica. So it is that sciatic nerve. And these are some nerves which comes from the front of the hip and goes down in the legs. So this is the femoral nerve. Then these are the cutaneous nerve, the small thin nerves which goes into the muscles and under the skin. And the same named arteries, the femoral arteries and all these things, they supply the hip joint and the bones. And these are the muscles which gives amazing movement to the hip joint. So this is one muscle, the tensor fascia lata, as we call. It's like a string, which goes right from the hip right down to the knee and still downwards. So this gives this is like an anchor of a tent. So this is what gives movements. Then these are the adductor groups of muscles, the inner thigh muscles that helps take the leg inside from outside. There are so many muscles over here, and these three main muscles are there: adductor magnus, longus and brevis, and this is the innermost muscle, the gracilis. Then this is a pectineus muscle which helps you to turn your foot inside or outside. That is what it does. And the piriformis. These two, one turns the foot out and one turns the foot inside. So these are all the muscles. All these muscles are attached to these bones, and wherever I have said many a time before in my lectures that there are small bags of oils which God has made as lubricants between these bone and muscles. Otherwise, all these muscles would become strained. So in cases when the muscles are overused, these small bag of oil known as bursa will get inflamed, and you get many conditions pertaining to this bursa, as I will talk in my lecture. Now the commonest condition that we see in day-to-day life is osteoarthritis of the hip, as we see of the knee. The best part about this condition, we know that osteoarthritis is a disease of wear and tear. But you will be surprised that knee joint arthritis, which we see in our day-to-day life, is a condition where people who are known to rest in air-conditioned cabins and with very less walk, they get knee arthritis. And those people who are used to doing real hard work, like farm laborers, people doing manual laboring, they all get hip osteoarthritis earlier than knee osteoarthritis. So knee osteoarthritis is basically a disease which can be prevented by working, and hip osteoarthritis is a disease which can be prevented by resting. Same way as we give, there are now so many different kind of medications apart from steroids, like natural lubricants which are available, made by genetic technology, which we can inject into these joints and re-lubricate it. And of course, last but not the least, that even before knee transplant came, hip transplant was quite an old procedure, and it was more frequently done because fractured neck femur is the commonest fracture that we see in all city dwellers. So this hip transplant was there right from beginning of, let's say, orthopedic, as it came as a faculty. Now, in the same light, I would like to speak about these stress fractures of hip joint. This is a very common condition, especially now when we talk about so much of the whole market is full of vitamin D3 and calcium and everything is there. So we see a lot of stress fractures of the hip joint, which is common in people who have got severe osteoporosis or osteopenia. These are actually what we call as hairline fractures. So these fractures occur more on the outer side than on the inner side. That's what we see. And you will not believe that sometimes X-rays miss these fractures. Even on a good X-ray, you will not be able to see these fractures. The patient will only say that I get pain. So when we make the patient sleep and turn the hip out in like this again and again, then we come to know about these fractures. You can see in this slide, it is just little visible that there is a fracture. The best way to know it is either by a bone scan, a nuclear bone scan, or maybe an MRI. So these fractures, the best treatment for the person is to rest and not exert, because all these fractures can heal just by themselves without doing anything. Sometimes when we know that it is very imminent or the fracture is very clearly visible, then the surgeon puts 2 screws so that the joint does not move away from each other. Once this happens, then the commonest thing that happens with these kinds of fractures, if you do not allow it to heal, is something known as avascular necrosis, which I will be speaking now. So what is avascular necrosis? Most of these joints, or any joint, has got more blood supply than the bones, because joints bear the stress of the weight of the body and movement. So it needs more blood circulation. Now what happens that in hip joint, this ball and socket has got a capsule, and that capsule also covers the part of the neck, and through this capsule is all the blood supply. Now whenever there is a fracture over here, this blood supply gets jeopardized and the bone goes into necrosis, or it gets degenerated, it crumples. So that is what we call it avascular necrosis. Now in this avascular necrosis, the commonest symptom is only pain. As you diagnose pain for all other fractures, the fracture of the kind of avascular necrosis pain is also the same, unless and until that the physician has to be all the time alert that there could be an avascular necrosis, and the early signs of avascular necrosis is diagnosed, and there is no treatment of this avascular necrosis but bilateral or sometimes unilateral hip joint replacement. That is the only treatment. Sometimes even in diseases like ankylosing spondylitis, it is a rheumatic disease, one of the commonest thing people get is avascular necrosis. The other cause, you all must remember this, is steroids and alcohol. Even for normal people, for no reason, taking steroid tablets, especially people who have asthma and myasthenia gravis and all these things, when they take steroids for a very long term, these bones all rot away and they form this thing. It's a very unfortunate thing to happen. Doctors prescribe steroids for some reason, and many people end up getting this avascular necrosis. So the only treatment is the costly surgery of total hip replacement and nothing else.
What about alcohol?
Alcohol gives avascular necrosis. So alcohol, actually first causes liver disease, and from that liver disease, so from the liver is one of the main organ which causes the metabolism of calcium and other things. So that it cannot do it, and so calcium does not reach over here properly, and that is why these avascular necrosis occur. Rheumatoid arthritis, ankylosing spondylitis, so many other things also causes avascular necrosis. Untreated fractures can cause avascular necrosis. Now groin strain. What is groin? Groin is the junction between the thigh and the abdomen. So the lower part of abdomen is also called as the groin, and all these muscles that you see, pectineus, as I enumerated before, this adductor group of muscles, magnus, longus, brevis, there is one muscle known as gracilis, all these are groin. And many times when he falls, people fall down like this, the leg stretches and for some reason it's a slippery thing and they strain these muscles or they tear a ligament. So all these different conditions can give rise to groin pain. Sometimes only the adductor muscles get stretched. We call it an adductor strain. So that also comes in groin pain. I will be showing you a slide on this later on. So we ask the affected person either to do these kinds of exercises to bring it back. First we give him rest. We may give him some simple painkillers, and once all this inflammation goes down, the fear is this, that these muscles become short and then they are not able to, they walk with a limp. So we give them these different kinds of exercises which I give as printouts in my clinic, or teach them these stretches. So under groin strain many things comes, because I showed you about so many nerves which are going in and around the hip, so many ligaments. All these things can get stretched and cause pain in this region. So that is collectively termed as groin strain. We will talk about different conditions individually also. I told you adductor tendinitis. Now people who have got my earlier lecture on foot, I had showed this slide that people with old age and all these things, they have got malaligned foot. So because of this malalignment of foot, sometimes for them to fall down is very easy. Also this is that adductor strain which I said. Strain, sprain, tear, they are all different grades of the same thing. Sometimes the muscle can get pulled, sometimes it can get partially torn, sometimes it can get fully torn. So I told you that sports injuries, bicyclists, I'll talk about the condition of these cycle people even in the city. So they get all these types of falls and they get groin strains. Why? Because all these muscles are attached to this bone. This is the pubic bone or the ischial bone. So these muscles of the thigh are attached over here, and we all sit on this bone. So that is why the sitting also becomes more and more difficult. We ask that person to sleep with this kind of a pillow or a common pillow under their leg, so they get relief, and these stretches we teach them. This iliopsoas tendinitis, this is a the most powerful muscle of the hip joint. There is one psoas muscle which comes from this vertebra and attaches on the lesser trochanter. That is one, I showed you the prominence of the hip joint. There is a greater trochanter and a lesser trochanter. And from the inside, this is a iliacus muscle. So both of them together forms the iliopsoas. So these iliopsoas tendinitis is a very common thing. Now you will see many people, they have got a typical kind of walk. Now you will see some foreigners, all these whites or blacks who are very tall, and you will see, if you want, the commonest example is this James Bond, Roger Moore. So he has got a typical kind of walk. We all feel that he is walking in style, but it's not that. When these people suddenly have a growth spurt, these muscles fall short and the bones become long. So these muscles cannot keep up with the length of the bone and they get stretched. So they have got a peculiar kind of a walk pattern. It's a kind of a limp, but that becomes a style.
What is the corrective measure?
The corrective measure is that in young people, we have to gradually tell them that how to, we show them these stretches. These are iliopsoas stretches. Sometimes these football people who are not, trained properly, and they enter into the game or something in the match, and they suddenly use this muscle by sudden kicking and all these things. So they get these iliopsoas tendinitis or a hip strain. Some person, while falling from the stool, what happens? That the legs remain on the stool and they have fallen down. So these muscles get strained. And it is very difficult to understand that what has actually happened, because he is not going to tell you. Sometimes the pain is on this bursa. This is a psoas bursa, where these muscles get attached to this bone. So sometimes the pain is over there. In old people, usually the strain is over here. In different people, the strain can occur at different places. In very young people, they get this back pain. In old people, the strain is over here. So we call it this way. So we teach, and this is how we diagnose. We ask them to flex or pull one knee up, and we push this leg down. So we come to know that there is an iliopsoas strain. Many a times, the last resort is to give an anesthetic injection into this bursa or in the muscle. But this is always done in a fluoroscopy or in an image intensifier. But this is a common condition in day-to-day life which a physician should know and try to pick it up.
Instead of anesthetic, can you use corticosteroid?
We usually mix a little corticosteroid because anesthetic per se by itself is very inflammatory. It causes pain. Secondly, anesthetic injection can cause a lot of allergy. So steroids even reduce that, and the effect of anesthetic lasts longer if you add a little steroid.
What is the proportion?
Depending on the amount of area that you have to infiltrate. Now suppose if there is one syndrome which I will talk, in which is a small cutaneous nerve has to be injected, neuralgia paresthetica. In that we have to inject sometimes 20 milliliters of anesthetic with half ml of steroid. And sometimes the condition, if somebody has to inject into the hip joint, then we don't take too much of anesthetic. We directly inject 1 ml of steroid over here because the space is very less. Only a small injection will do the trick. But in these cases it's different. This is a very interesting condition. We call it a snapping hip syndrome. Many people have it, but because they don't know what is it, so they don't go to doctors. They think that okay, it's a part of it, unless and until it becomes too painful. Now, as I was talking to you, that this is one iliopsoas muscle. So when this gets strained, or there is an inflammation, what happens is this muscle rubs with the inside bone suddenly. When you are sitting and you try to get up, you feel there is a click or a snap inside. You just feel it. You will not be able to demonstrate it. So this muscle goes on rubbing. Sometimes somebody has got a fracture over here, which has been repaired in past. So this muscle goes on, this is the iliopsoas muscle, this goes on rubbing with this bone. In medical language we call it ilio, uh, uh, iliotibial eminence over here, because there is a raised bone over here. So this is how we diagnose, whenever there is this thing, and they will feel it. Same thing over here, that there is one muscle which is outside, as I was telling you, this tensor fascia lata. So over here and this gluteal muscle, they rub with this pelvis over here. So somebody who is rowing, suppose we are doing a boat, or if I have to get up again and again, bend my legs and get up for some work again and again, I will feel that click over here. So if you want most of you to demonstrate it, the way to demonstrate is you have to bend your legs, bend it outward, and then try to straighten it, and it will straighten with a cluck like this. I can feel it right now. You all can try this at home. That does not mean that all of you have got this snapping hip syndrome, but this is how it manifests, and this is how we know. These sports people get it very frequently when especially those who are in long jumps.
Football.
Long jumps and football, because when they jump, or they've got that they've got pole vaulting, so when they jump from that, they suddenly feel that pain, because this rubs very hard over here, and they get this snapping hip syndrome. This snapping hip syndrome, as I continue with the same thing, that you saw that external snapping hip syndrome. So in this condition, you can see that muscle, tensor fascia lata. After snapping hip syndrome, trochanteric bursitis. This is that muscle. Now this is shown in a diagrammatic way. This rubs with this. This is a bursa over here, known as trochanteric bursa. This is very common condition. This is common in Indian ladies, because Indian ladies God has given a very lovely hourglass figure, with large pelvis. So that is why in the Indian ladies, I have injected many times this bursa, because this muscle goes on rubbing over here, and vice versa in that internal snapping hip syndrome. Those ladies who have got a small pelvis, foreigners, Chinese, they get that internal one, and we all get this external one. We also call this iliotibial band syndrome. So when this occurs and the bursa is inflamed, then many a time we have to inject this, or we have to show people this kind of stretches. You have to have that Shri Krishna position all the time, and you have to learn to stretch your leg. This is how we inject the bursa. Ladies who are we call that Gandhi Jholla, who carries these kinds of bags, rubbing all the time with their hips, they get it. People who have got some prosthesis or supports for their legs, and they fall down, sometimes they also get inflammation of this bursa, and this is the kind of pain that you get. So this trochanteric bursa is very common in common people. It's not related to sports. So one is this iliotibial band syndrome. As I told you, this muscle, it goes from the hip right up till the knee, and it is attached at two places. One is, as I showed you, on that bursa, the trochanteric bursa, and the second is the knee. We call it Gerdy's tubercle. So people who are cycling, and they have got the cycle or the two-wheeler is such that when they're resting their leg, the leg is on little behind. In scooters we usually put the leg in front, but in many motorcycles the leg is behind, or the pillion rider, if they have to ride on that motorcycle for long distances with the leg behind, they get strained continuously on this muscle. So the strain is over here on this knee and on the outer side. This is known as Gerdy's tubercle. So they get this iliotibial band syndrome, and we have to advise them to sometimes change the position of the bicycle, or you you sit behind or adjust the seat, and we ask them to sit with a leg in a little broadened like this. So that is this, and in many severe cases, I have seen it in obese housewives, this kind of condition, and we ask them to sit. Sometimes we give injection in that Gerdy's tubercle and they become alright. Now, osteitis pubis. This is a very common thing in sports, especially people who are playing rugby. What is osteitis pubis? This is the pubic bone, and it has got a joint which has got a cartilage, just like our spine. So this gets inflamed, this cartilage, and the inflammation spreads on the sides and all the muscles which are attached. So you can see on X-ray that this thing gets detached. Now in common people, whom do we see this? Those who have got some spine surgery, the back surgery, the leg, one leg has become short, so they have to walk like this. So the arrangement of this hip and pelvis is not proper. It gets separated a little. So they get this osteitis pubis. But in sports, these people who are playing rugby, ice hockey, where they have to push, jostle, change direction of running suddenly, they strain this joint, the pubic joint, and they get all these osteitis pubis. So sometimes we ask, first is to ask them to rest and give them painkillers till all the inflammation goes down, and then we give them these kinds of stretches, or this is known as the plastic ball kind of stretch. We ask them to press it between the legs. So all these things may gradually reduce it. Osteitis pubis is one of the commonest that I have seen in hospitals when I was working. Was you can see, you must be remembering, when you go to the hospital, so many old people carrying one catheter in the bladder and carrying that tube, walking like this. So they get infection, and the infection is really very severe. Those bacteria cannot get killed. So they get infective osteitis pubis in those people. So it is very difficult to treat, because sometimes you have to inject antibiotics right over here. So these are common things which we see even in day-to-day lives. Hamstring strain. Hamstrings, everybody must be knowing, because hamstring is the most talked about muscle. These are three muscles which are on the back of the thigh. They are known as semitendinosus, semimembranosus and biceps. They start from the hip and they join the leg just below the knee. Now, in common day conditions, what we see, people who are not used to running, suppose somebody has to catch the bus, an elderly person, and he or she is not trained to do running and all these things, and they fall down. So they tear one of these muscles, or they strain it, and they get this hamstring strain. So sometimes we see a little tear. It can be made out by doing an ultrasound. So with ultrasound, we come to know that whether it's a tear, or sometimes it's just a sprain, or there is a blood collection. So we allow all these things to heal, and then we ask the person to do these hamstring stretches. Sometimes we ask them to even to put a leg right on this table and push down the hamstrings, and they become alright. Because if you do not do that, then gradually what happens, these hamstrings, because they are attached to the hip over here, they become short, and the leg is permanently bent like this. So this is a very common condition even in people who are resting on the bed, bedridden patients, old people. For long times when they are in the bed, they get these hamstring flexor spasms, and it is very, very difficult to again re-straighten the leg.
So nowadays it's very common disease, like
very, very common.
Especially the cricketers and all this other.
Yeah, they get hamstring strains, hamstring spasms. Suddenly he falls down, severe pain over here. He's torn it.
So it can be cured by that light.
Yeah. No. We give him ultrasound. There is ultrasound. One is for diagnosis, and one is an ultrasonic wave which we give. And
it is like a light only.
No. That ultrasound is that screen in which we for diagnosis we use. Okay. And there is one is an ultrasonic wave therapy. So we give that ultrasonic massage over here, and all that blood collection goes away.
How safe is it?
Very, very safe. Nothing can be more safer than it. Even you can give it to pregnant ladies or
through machine only.
Yeah, there is a machine.
Not through hand massage.
No. There's a probe on it, and we go on rubbing. We put some paraffin oil and then we do it.
What is the idea of paraffin oil so as to
Paraffin oil conducts that ultrasonic waves very easily, deeper inside,
deeper penetration?
deeper penetration. Same way, what you saw on the back of the thigh occurs in front of the thigh. So what these front muscles are known as quadriceps. This is very common. Somebody who is not, a good swimmer, or first time he wants to just jump into the swimming pool, and he ruptures these muscles. I have seen 2 to 3 cases like this. Or somebody kicks a ball, he is too much in excitement and he kicks the ball very hard and he will tear these muscles, these quadriceps. There are 4 muscles over here. So he tears the main muscle, the rectus femoris. And sometimes, as I said, that there are 3 kinds. One is the complete tear, one is a partial tear, and one is just a pain or strain. And the bleeding in the front part is too much. I have seen 2-3 cases like this where a lot of blood was there. So I had to ask that person to rest for 15-20 days. And there are these quadriceps bells which are available which prevents further bleeding. Initially we ask them to rub ice. After the bleeding stops, we ask them to put hot compresses. And when the pain and everything goes away, then we ask them to do this quadriceps static exercises. They have to tie a weight on the leg and straighten the leg up and down.
But sir, sometimes I find when we go for swimming, that a lot of stress when we put in this portion gets stuck up. So that also same thing.
No, this as I agree with you.
Yes, sir.
That swimming, what you are saying, is that calf muscle strain. That is a different reason. But here, people who do this frog style swimming,
Frog style, yeah. Frog style, yeah.
they rupture these muscles faster than that calf muscles. Calf muscles is in that freestyle.
Freestyle. Yes.
While this frog style gives this kind of
I see.
pain. Sacroiliac, one of the commonest thing which I see as a cause of low back pain. This many people come over here and they show this. So people who have got a continuous sitting habit on these kinds of chair, when this is the joint, the sacroiliac joint. This is the pelvis, this is the sacrum, and this is the ilium. So this joint, it gets inflamed. Many people will come with low back pain. Now sometimes this pain comes from the upper vertebra, the L5S1. So we have to really find out what is wrong. And we give simple painkillers and we give them these sacroiliac exercises. I have got all these charts. If anybody is interested, do let me know. I'll give as many as you want. So we give this when nothing, because the sacroiliac joint is a very typical joint. It has got 0 movements, and it gives all the weight is borne by the sacroiliac joint of the body through the pelvis. So when nothing works, then we give an injection into the sacroiliac joint by seeing it in a TV, that is in a fluoroscope machine, because otherwise the injection needle will not go deep inside the joint. But this is a very, very common thing, especially in postural back pain. We see the sacroiliacs. You can see, we call this sclerosis or hardening of the bone around the sacrum and the ilium. Sometimes we ask them to put this sacroiliac support, but then this has got its own disadvantage because it compresses so many nerves wearing it.
These needles are special needles. The needles that we use are special needles.
Yeah, special long spinal needles.
Deep penetration.
6 inches thin needles which we give. Piriformis syndrome is very common in people who have got small bakras, small shops, because these people have to sit all the time.
Right.
And they usually sit on hard surface or stools. So what happens, that just like sciatica, in sciatica what happens, this is the sciatic nerve. So the sciatic nerve gets compressed by an intervertebral disc over here. But in this case there is a piriformis muscle. This muscle I showed you before, it starts from here and it gets attached to this greater trochanter. And the nerve passes from between the 2 bellies of this piriformis muscle and it gets trapped over there. So this person, you will always see that he is little bent, and he is afraid to sit. After sitting, you will see in 10-15 minutes, he knows that he will suddenly walk up and he will walk a little and again go and sit. That's how we come to know. And how do we diagnose? we have to ask this person to lift his leg a little. We ask them to lift his leg, and he will shout. Unlike in sciatica, when you have to stretch the leg completely to 90 degrees from the hips. But in sciatica or in this piriformis syndrome, again the sciatic nerve is compressed, but just by lifting the leg a little, he will get pain. And we know that it is piriformis syndrome because the radiation of pain is just like sciatica, right from here to the leg. So it is very confusing with sciatica. But if you have to diagnose piriformis syndrome, one of the best thing is MRI because it will show these enlarged piriform muscles. And once we diagnose, we ask them to do all these kinds of stretches. This is also one way to diagnose as well as to treat. This is a classical piriformis stretch. With one leg, he is asked to stretch the other leg, the affected leg, towards his chest, and the piriformis muscle becomes less and less taut and leaves the nerve. The other is this obturator nerve entrapment, commonly seen after pregnancy in ladies. When there is a very difficult delivery, like the child is big, or you have to bring out the child with the help of forceps, or sometimes in sports people when they have got some fractures over here around the pubis. So this nerve gets entrapped in the fascia or the inner lining of the hip and pelvis. Then they get this pain which radiates to the inner side of the thigh and into this groin. So sometimes people think that it is an hernia, and this obturator nerve is there. Now obturator nerve we have to diagnose by pressing the nerve by putting our fingers, sometimes in males to the anus and in ladies to the vagina, and that nerve when it gets compressed in the hip bone, there is something called the sciatic notch, a small bony spicule, so that the patient shouts when they feel the pain. And the only treatment many a times is, sometimes we give a block, but most of the time we have to release the nerve surgically. This is the surgery which they are doing for releasing the obturator nerve. The other is pudendal nerve entrapment. This is a very interesting pain usually in bicycle riders who have got a very thin bicycle sheet. You see, God has made this bone to sit on, but the seat is pressing over here. This bone is not resting at all. So this pudendal nerve gets trapped over here, and these people are really in a very bad shape. They get severe pain around the genitals. They become impotent. They cannot control the urine. Sometimes they cannot control even their stools. It was a common condition once upon a time in Spain with these matadors, those who used to show this kind of sports. So again in this case we diagnose or give a block to the nerve by putting the injection through the vagina, or sometimes you have to do a surgical decompression. Pudendal nerve. These neuralgia paresthetica, as I told you, very very common, especially when we go to some other town and we are not used to walking and we want to see that town walking. So you get a chilly like sensation on the on the front and the side of the thigh over here. Very common in people like me who are obese and who wear belts below the tummy. So those below the navel, those people, they compress this nerve. This nerve is just it is behind this inguinal ligament. You can see this bony spicule, this over here. So this is what we call as an anterior superior iliac spine. This is the spine of the hip bone, and there is a ligament coming over here. This is a very thin nerve. They have shown a thick one over here, but it is as thin as a hair. And continuously you get something as if some insects are crawling over here, or pain. Even if you are lying, you do not know what is happening. You will feel that some pain is going on. And sometimes people go to the bathroom again and again to see if there are some insects traveling over here. So they get this pain. This is the area. There, as I said before, that we give these injections with large amount of anesthetic over here. And because we give a large amount, this nerve separates from that fascia in which it is trapped and the person gets cured. In rare cases, very rare cases, you have to get a surgical decompression. Other is this ilioinguinal nerve entrapment. This is a very common thing in people who get operated for appendicectomies. Ladies who get hysterectomies done, the uterus removed, or people who have got hernia and they are repaired for this hernia, and sometimes the surgeons put a mesh or a jali inside.
Yeah.
So these people after the surgery, for some days or sometimes even for months or years, they get this pain in the lower abdomen, because what happens, this is a very thin nerve which gives sensations to the skin around the abdomen. As I told you, hip and pelvis means this region, even including the lower abdomen. So they get this nerve trapped over here, and sometimes it responds to this anesthetic and steroid injection, and many a times you have to do a surgical debridement. But that man will say that I have got myself operated, why is the same pain coming here and again and again? These are thin nerves which comes from the back and supplies the lower abdomen and the genitals. They get the pain coming down to the scrotum, and it's really very painful. I have seen and treated these cases. Ischiogluteal bursitis. Commonly it is known as the tailor's bursa, because tailors, you will see in small gowns and all these things, they sit on a stool and all the time they have to do like this. So they are sitting and giving weight over here, but there are two bag of oil bursa on each side, so they get inflamed. Sometimes they are thick or as heavy as elephants, or sometimes they use wrong chair. So this is the place where it pains, and we usually get it cured by conservative treatment, but sometimes we have to give an injection over here. Last but not the least, very very common condition, I am sure somebody must have been affected in their life, is this coccydynia. Coccyx is the tailbone. So after that sacrum, which I was talking about, the last 5 vertebrae which are fused are known as coccyx. Those people who have got a habit of sitting on chairs or stools and leaning backwards, young students now who have got this very bad posture watching TV and all these things, in this, they get this coccyx pain. So the coccyx is supposed to be straight, but when they sit in a wrong way, it bends like this, and sometimes this gets inflamed, or the ligaments which are joining it to the pelvic bone, they get inflamed. Sometimes they fracture the coccyx. So when we see this, we put our finger through the anus and try to manipulate it back into shape. But many a times I have given injections in and around the coccyx, because this is the pain. You ask them to sit on a hard stool, or you ask them to ride astride on a motorcycle, they will not be able to do it. Most of the time in ladies, we have to give them this green ring, this kind of a ring pillow on which they sit, and the pain goes away on its own. So these are few things which we see in day-to-day lives. I think that brings me at the end of the lecture.
Thank you very much.
That green pillow, sometimes the piles will
She should not fall. Okay, one. Second thing that I tell people when they bring their old parents to my clinic is that when they are, you see, they get, suppose in males they have got prostate and they have to go again and again to the bathroom. So I tell them that please keep the lights from their bed to the bathroom on whole night. Third, I ask them to put nylon mats in the bathroom. It is because we get those mats on which you can pass urine. Rubber mats or nylon mats, both we get. So they can pass urine on them. Okay. Third, I mean, if you can afford it, please don't put granite or marble in your house.
particularly this highly polished.
Highly
Yeah,
polished.
it is a
Old
now
modern
tendency to
tiles
put
are anytime better.
everywhere.
Slippery.
Yes.
Slippery, and it becomes slippery after bath or something.
Correct.
Not
And we
little water
get
you
tiles
can't
now
see. Yeah.
which are corrugated. Ashi tiles मिळते.
No, but even old time mosaic tiles are quite good. They were
Very
not-
good, absolutely. They are not
I
slippery.
don't know, not slippery. People never used to have a bomb.
And nowadays
this-
you are
today's, highly
hearing a
polished-
lot of
Yeah.
elderly people
absolutely.
Falling on this.
especially
Yeah.
in bathroom.
Absolutely.
Because of the soapy.
No, even elderly people, the bones are so soft that they are sitting down and they just fall down. Suppose they are sitting passing urine and they are not able to bear their own weight and they just sit down on the floor. It's enough to fracture your bones.
Yeah.
Old people who are just sitting on the soft bed, they fracture their bones. Secondly, in young people, I always tell, please don't drive your two-wheelers beyond the speed of 40. In Bombay, beyond 40 you reach nowhere. If you are at 60, you will meet the person who is going at 100 on the second signal, if not the first. So don't do this racing. Okay. And third, that including me, as I said, that stop air-conditioned cabin cultures, weight-bearing exercises in the sun or weight-bearing walking for 1 hour 2 times a week in sunlight, if possible in afternoon, but if not possible in morning, is a must to prevent all this.
Means you have to walk 1 hour.
Walk 1 hour.
Once
And
in a
all
week,
these
once
things
in a
can-
week.
Please repeat
once a
it.
week is also
Please,
enough.
please repeat it once again.
Walking in sun, that is weight bearing activities in the sun. If you are not able to do it, suppose if you do not have the time to walk in the afternoon, ladies can just simple do, if they can do skipping, but skipping is little hard. But if you can just jump on that place or on a soft thing for 5 minutes, that's enough. Or you just hold a chair and sit down and get up for 10 minutes every day. That's enough to prevent all these things.
But continuously walk in the sun 1 hour is very difficult. In the afternoon, it's burning.
I
In the
know, but
morning-
see, we have got used to it like this.
We made
So,
ourselves
so,
like that.
so we will don't have all this problem.
Yes, we will not have all these problems. I go to villages. I have been to most parts of the Middle East. There, you see, now it is like this that they cannot live without AC on 12 and 16. I tell them, what were you doing 30 years back? There was no
Yeah.
AC.
Yes,
You are living
Right.
with simple food, and now you need all the best food in this AC culture.
But now they're
So
spoiled.
stop this, they are spoiled. They need everything AC. They cannot tolerate AC at 20 also. They need 12 or 16. That much chill they need.
Oh my God.
So if you can stop
Now they are
the AC
used to
culture,
it.
now they are used to it.
Used to it.
So people get all these problems.
See, another thing I noticed of late, these youngsters, they want a sports bike, no? So the seat is small.
Ah,
Exactly.
yes.
And they're getting all this problem. They go home to the GPs most of the
Very
time
small.
complaining, and they get some painkillers. Then again and again it is recurring.
Do you know, adding fuel to flame is one is this sports bike culture and second is smoking. I know children of so many people who have come to me in young age. One is when they get married, their wives are not able to conceive. And secondly, if the wife become pregnant, they lose their pregnancies because these things stop the blood supply into their testicles where the sperms are produced and in their genitals. So they are not able to conceive their marriage. I mean, it's a very high price that they are paying for all this fun which they have in their young days. I am treating now a young boy about 20-21 years of age. He has had this spine fracture.
Oh,
Finished. Oh, he has got a
paraplegia.
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 His life is finished. Gone. So what are you trying to achieve by doing all these things? Nothing.
So one